Hello from the Charlotte R. Bloomberg Children's Center at Johns Hopkins Hospital. My name is Kelsey. I'm the child life specialist in the perioperative area at the Children's Center.
And I am Dr. Sapnika Chadkar, anesthesiologist-in-chief of the Johns Hopkins Children's Center.
This video is intended for parents and caregivers who are preparing to bring their child to the Children's Center for surgery or a procedure under anesthesia. We're here to discuss the different ways you can help us reduce your child's anxiety on the day of their procedure. If you're looking for information about what you and your child can expect on the day of surgery, please reference our Preparing for Surgery video at the link in the video description.
We will outline different strategies you and your child's care team can implement to help reduce their anxiety during anesthesia induction. It's important to note that not every strategy will be available or appropriate for every child. Your child's anesthesiologist will meet with you prior to or on the day of your child's procedure and will formulate the best plan to support your child.
It is completely normal for children and teens to be nervous in the days leading up to and on the day of a surgical procedure. Many patients benefit from asking questions about their procedure and learning about what to expect in the hospital environment. Scientific studies have shown that caregivers who convey confidence and comfort when discussing surgery with their child can help decrease their child's anxiety. If you have questions or concerns about how to prepare your child for surgery, a child life specialist can help explain things in a way that your child understands, as well as answer your questions about the hospital experience.
Many patients experience anxiety as they transition away from the preoperative area and into the operating room. A child life specialist or other member of your child's care team can explain what will happen and answer your child's questions. Many children experience less anxiety when given developmentally appropriate information about what to expect. In addition to preparation, your child's anesthesiologist may be able to give them medication to help reduce their anxiety and make this process easier. There are medications that may be given to your child by mouth, through their nose, or through an IV. Your anesthesiologist can discuss the side effects and benefits of these medications with you. Most relaxing medications will be given about 15 to 30 minutes before your child's taken to the operating room. Many patients experience decreased anxiety when given these medications.
Other methods that can reduce anxiety include having patients engage in distracting activities and play while transitioning to the operating room. This could include using an electronic device, playing with a toy, or having conversations with their doctors and nurses. Patients may also bring comfort items like blankets and stuffed animals into the operating room with them. These items and activities can help patients feel less anxious in the operating room setting. A child life specialist may be available to facilitate distraction activities with your child and provide emotional support until they fall asleep.
In some cases, such as when patients are unable to receive relaxing medications or unable to engage in distraction, the care team may allow one parent or guardian to accompany your child into the operating room to comfort them as they fall asleep. This is called a parent-present induction. Your child's anesthesiologist will determine whether it is safe and appropriate for you to be present during this process.
There are a few factors that help determine whether your child may be able to receive a parent-present induction. Parent-present induction may not be appropriate for patients who have adequate sedation from medications, children too young to experience separation anxiety, and those who are not experiencing anxiety. There are many things that your child's care team can do to ease their anxiety and keep them comfortable during the transition to the operating room, including holding or swaddling them, playing music, and soothing them verbally. Our primary focus is the safety and comfort of your child, and we will utilize the techniques we find most beneficial to them to optimize their perioperative experience.
Not every parent is comfortable with being present with their child in the operating room or seeing their child go under anesthesia, and that's okay. In this video, we will provide some guidance to help parents and guardians understand what this process entails, so you may decide if you're comfortable being present in the operating room if the anesthesia team deems this approach to be appropriate for your child.
Next, we're going to demonstrate what will happen when your child enters the operating room and goes to sleep. In most cases, this process takes less than 5 minutes. Your child will be under the care of an anesthesia staff member throughout their time in the operating room.
When your child's team arrives to transition them back to the operating room, your child may sit or lay in bed, be carried, or walk independently. They will take your child to the operating room where they will receive medicine to fall asleep. If you are going to accompany your child into the operating room, you'll be given a bunny suit, hat, and mask to put on over your clothes. These items help make sure the operating room stays clean and safe before your child's procedure begins.
The operating room is filled with equipment that will be used to care for your child during their procedure. There are screens throughout the room to help the team monitor your child's heart and breathing during the procedure, bright lights on the ceiling, and a surgical table in the center of the room. There may be surgical tools on the side of the room, sitting on top of blue towels. These blue towels indicate that the area is sterile. It is essential that these items must not be touched as people enter or move around the operating room.
Many patients also notice that the operating room feels cold. We can give your child a warm blanket to help them feel more comfortable. There will also be different clinicians present when you and your child enter the operating room. Your child's anesthesia team will be helping your child fall asleep and guiding them through the induction process. There are nurses assisting the anesthesia team during induction and setting up equipment in the operating room. Your child's surgeon may also be preparing the operating room during this time. If you accompany your child to the OR, this may feel overwhelming. Try to focus your attention on your child and the staff members guiding you through the induction process.
Once your child is in the operating room, staff members will help them move to the surgical table and untie their gowns so they will not lie on knots while asleep. Patients should lie flat on their back, and once they are in position, a nurse may place a safety strap over their legs to help keep them safe. This should not be uncomfortable for your child. Patients may also continue to hold their comfort or distraction item during this process.
Once your child is in position, the anesthesia staff will place monitors on your child to help keep them safe. They will place a pulse ox sticker on their finger, EKG leads on their chest, and a blood pressure cuff on their arm or leg. None of these items are invasive or painful for your child. If your child has an IV before they go to sleep, the anesthesiologist will hook up the connection site so medication can be administered. If your child is going to sleep with a mask, the anesthesiologist will hook up the mask and tubing to get it ready for use.
Your child's anesthesia team will be standing at the head of the table, and a surgical nurse will be standing next to your child to assist. If you accompany your child into the OR, you may stand next to your child so they may see and hear you during this process. As your child begins going to sleep, you may comfort them by talking or singing to them, holding their hands, touching them soothingly, or simply making eye contact. The most important thing you can do for your child is to remain calm during this process. Children's emotions are strongly guided by observing their caregivers, and caregivers who are able to remain calm can help decrease their child's anxiety. Sometimes children try to push away the anesthesia mask or struggle to hold still. You can help your child and their care team by gently restricting their movement and providing reassurance. Anesthesia staff, nursing staff, or a child life specialist will also do these things to comfort your child during this process if you are not present in the OR with them.
As your child falls asleep, they may make unusual eye or body movements and have altered breathing or coughing. These responses are totally normal when children are placed under anesthesia and do not mean that your child is in danger. The anesthesia team is closely monitoring your child throughout the entire process and are trained to respond if your child needs urgent attention.
Once your child is asleep, you will be able to quickly say "see you later" to them before exiting the OR. It is essential that caregivers exit the operating room quickly once instructed to do so. The anesthesia team is going to be working quickly to care for your child, and it is important to avoid distractions during this time.
Many parents are emotional after leaving the operating room, and this is totally normal. Once you've exited the room, our team can provide support to help you through this experience. When you're ready, a staff member will escort you to collect your belongings before returning to the family lounge, where you'll wait while your child is in their procedure.
Parker is autistic. He has receptive language disorder, and he is nonverbal. I struggle with terrible anxiety, and I really did not want him to sense my strong emotions. And so the staff was extremely kind and walked us through step by step what would happen to Parker once he went into the OR, and told us that he would be okay, and he was very well taken care of. They came up with a plan to design a really wonderful sensory space that was absolutely incredible. And we were so grateful, and he had a really good time in the space, and he was extremely regulated, and I really don't know what I would have done without them.
My son Peter's now 5.5 years old. He has been under the care of Johns Hopkins since he was 10 years old, and between 10 and 18 months, he had multiple procedures under general anesthesia. The whole experience ended up being much less stressful than I anticipated. When we got to the hospital, the nurses were amazing. Peter almost viewed it as like a fun activity he was part of. They knew exactly how to interact with him leading up to it. I was able to go back into the operating room with him. So prior to the procedure, he was never away from me. He had a stuffed animal, but I don't think he needed it. He watched a show on my phone going into the operating room. And while we were in the OR, while he was being put to sleep, a nurse offered to hold the screen for him so that I could really focus on holding his hand and comforting him. And from beginning to end, it was a lot easier than I anticipated.
We hope that this information has helped better prepare you for how to support your child on the day of their surgery. We know that bringing your child in for a procedure is a stressful experience, but our staff is dedicated to taking excellent care of them.
Your child's care team will discuss the best way to care for your child on the day of their procedure. We encourage you to reach out to our Child Life team if you have concerns about your child's coping, or to their surgery team if you have questions about their procedure.
Please utilize the resources in the video description for additional information about how to prepare your child for surgery, as well as information about preparing for your child to receive anesthesia. We look forward to supporting your family through your surgery day experience.